Hello and welcome to the Voice of Rio Grande. I'm Craig Klein, Dean of Community College Programming at Rio Grande Community College in, where else? Rio Grande, Ohio. Welcome to the program. We'd also like to welcome Perkins Community Television from Youngstown and Anderson Community Television in Cincinnati. Welcome to you both. Today I'm excited to have as my guest Mrs. Dena Warren, who is the Dean of Students here and also a classroom instructor for our new program in Chemical Dependency Counseling Assistant, CDCA. Welcome to the show.
Thank you. Thanks for having me.
So it's no secret that our part of the world struggles with chemical addiction issues. And it seems incumbent upon those of us who engage in post-secondary work to try to create a thoughtful response, and perhaps an ongoing one as well, to address the obvious needs, concerns, and to try to be part of a solution. And so I'm asking you to start with, why would we need CDCA training? How does this address any of these broader issues that we have in our region?
Well, I think if you look at the agencies and the service agencies in our Tri-County area, they deal with chemical dependency issues. You know, we encourage prevention in our schools, and then we try to offer treatment options for young adults and adults throughout the counties. And so through discussions with our local Gaia-Jackson MEGS Board of Alcohol, Drug Addiction, and Mental Health Services, we have found that qualified CDCA applicants are minimal. And so providers need these positions. They need employable staff. And we thought it was just a win-win situation for the university to tie it into psychology and social work programs and offer students an option for a certification that allows them to both work while they're finishing their degree.
Okay. So that gets kind of to the heart of my next question. Who exactly would be interested in this kind of training?
I think really any student can use it as a standalone certificate, but anyone that wants to work maybe in adult or juvenile probation, someone that wants to work in a social work organization or agency provider, someone who wants to work in the treatment field would be ideal for a CDCA certificate.
Good. Let's take a look at the first slide that shows a course that has been created for this. There we go. So we're calling it Introduction to Chemical Dependency Counseling.
Right.
And who would the instructor of this be?
That would be me.
Okay.
I actually have been in treatment and prevention since 2002 in Gaia and Jackson counties, and prior to my full-time status here at the university. And so I've worked in prevention in the schools, and I actually worked as a CDCA when I was executive director of Family Addiction Community Treatment Services. So I teach some courses here at the university as an adjunct, and this will be an additional course that I will be teaching starting in the fall.
That's great. So this class is coming in the fall.
Yes.
And as of the recording of this program today, we have openings.
Yes, we do.
We do. Wonderful. So we're going to get right into the specifics of things here.
Okay.
So I understand that there are 6 actual components, if you will, in order to earn a CDCA. So I want to take them by the numbers here.
Okay.
And discuss what they might be, and just add a little detail to this. So number 1, as you can see, is the course would cover theories of addiction.
Right, and that just means that we want students to understand substances and their effects. So it might be signs and symptoms, it's going to be long-term and short-term effects, and they need to understand what these drugs are. I mean, alcohol, tobacco, marijuana, they need to understand the rave drugs, prescription medication, over-the-counter medication abuse, just a whole host of just understanding substances and their effects.
So this goes well beyond opioid issues and concerns.
It goes well beyond that.
A whole range of other things as well.
We're going to look at stimulants, we're going to look at depressants, we're going to look at hallucinogens, we're going to look at inhalants, we're going to look at performance-enhancing drugs. It's just running the gamut of substances that can be abused.
Okay. Let's take a look at the next slide. So Second thing that is clearly covered is counseling procedures. Why don't you tell us about this and strategies with addicted populations?
So with this, we're going to review the stages of change. We're going to look at engagement strategies. There's 3 primary models of treatment, and so we're going to, within that 14 hours, just cover everything and anything about counseling procedures, strategies with those addicted populations. There's lots of different models that people use and different formats. And usually when you get to the CDCA step, for each person it's going to be individualized, but the information is going to be basic for everybody.
So the procedure one uses, the specific procedure, is dependent upon the substance that is creating an issue?
Yes, it can be, because the triggers are going to be different. And so the environment that the user is in, the way the user is using, the triggers that come along with that use are very much a component into treatment procedures.
Okay. But it also seems logical to think that they may have some things in common.
They will,
well.
just the
Certain
addictive
kind of
quality
behaviors.
itself, yes.
Okay, very good. Let's take a look at the next one. This one refers to group process and techniques and working with addicted populations. I guess I would begin by asking, how do you find an addicted population? How do you find more than one person that this would cover? How does the group get together?
Well, unfortunately, it's not hard to find, because when you look at the addictive population, when you look at some of the issues facing communities, especially ours, you do have people abusing similar and like substances. And so when, speaking from my experience, when we would have a group process, it might be a woman's group. And it's not necessarily they're always using the same drug of choice, but they could all be using in similar like circumstances. So their dependency issues could be very similar, or the reasons they're using could be very similar. And so when you put a group together, it's not so much that the people have like substance use, it's that the people need, that group would still need the same treatment protocol.
Okay. So would we find these groups them presenting themselves voluntarily or otherwise at facilities, treatment facilities, counseling facilities, or will we find them also in incarcerated situations?
It could be both. Lots of times treatment doesn't come by choice. It's been my experience that sometimes there's a nudge or a court issue or court order. And so it's just getting that person to buy into the treatment. Your relapse rates are going to be lower when someone believes in the treatment procedure. When you have a judge ordering them to be there weekly, sometimes there's hesitation, there's resistance. So it really just depends on the person. The important thing to remember is as we go through the CDCA procedure, we're just developing the person to be able to deliver the service. We can't promise that they're going to be 100% effective, because we don't know what the person on the other side of the table is going to receive or going to react to that treatment. We can only give them the foundations to present assessment, treatment, interaction, engagement, and then hopefully the services they provide will be beneficial.
Very good. Let's move on to the next slide. This one would be assessment and diagnosis of addiction. So clearly this goes beyond, I suspect, to a more diagnostic, clinical kind of approach?
Right.
So.
Yeah, the CDCA wouldn't be diagnosing, but they would be screening and assessing. And so there are certain tools that they would have to be able to assess and then pass information on to, you know, a clinical diagnosis or clinical diagnosable I just lost my train of thought. Someone who can clinically diagnose the person,
Sure.
But the CDCA is kind of the start of the procedure. They do all the intake, they take in the information, you know, the age of onset, the frequency of use, all of those questions that will be passed on then to a clinical supervisor or clinical counselor that would then diagnose.
All right. Is there any chance that the person they're interviewing or doing the initial assessment on would be less than truthful?
Absolutely. Very common in substance abuse, because you don't want to be the person that, you know, tells all the bad things, and you don't want the person sitting across from you, you know, to know some of the things. And sometimes there's, you know, criminal activity or, you know, things going on that you don't want other people to know. So yeah, it's not always, you know, 100% honesty, but again, it depends on that person buying into the treatment. I mean, someone who wants to get help, that opens himself up for the opportunity, is going to be more receptive and more successful.
Very good. Thank you. Let's try the next slide, please. So, treatment planning. I'm watching hours go by here, and it looks to me like this is a fairly healthy chunk of the overall program. It certainly has its fair share of hours. So this is not actually the treatment, but the planning of the treatment.
Right. Individual care plans, individual treatment plan are a must because everybody is different and everybody's situation is different. So what you do as a CDCA is you do comprehensive case management. In other words, taking in all of that information, assessing all of that information, making sure you have everything that then the clinician would need to do the diagnosing. So the CDCA is an important step here because you're the information gatherer, and it's important that you collect that information then to pass it on.
I see. So the CDCA would work in some sort of close tandem relationship with the actual counselor?
Oh, absolutely, yes.
And so they wouldn't know each other.
Right, right.
On a fairly consistent
Correct.
basis. Okay. Let's take a look at our next slide. Next up, we have legal and ethical issues pertaining to chemical dependency. The legal issues I can probably make a reasonable guess at. What are the ethical issues?
Well, I mean, you have to be professional. And so, you know, there are ethical standards there, but then also you have a scope of practice. And so you want to make sure that you as the CDCA are staying within that scope. In other words, we talked about how you would pass on the information to a clinician to then diagnose. A CDCA isn't going to diagnose, so that is beyond their scope. If it's something that, you know, steps in or poses a threat, there are certain things you would do in that case. Again, lots of times the clients you see are, you know, court ordered, and so they're already involved in either drug court or municipal court, and so sometimes situations happen where the CDCA needs to then, because of ethical standards, let someone else handle it. You know, there's certain information that you cannot always keep confidential because if it is a risk to someone else, then it's something you have to disclose.
Okay. Are CDCAs mandated reporters?
Yes,
they are.
They are. When it comes to issues like child abuse, elder abuse, yes,
okay. They are. So, would it be fair to say that there is sort of a prescriptive list of what good ethical behavior would be?
Yeah, I mean, there is. A lot of it's common sense, but then you also have to realize, like, I mean, there's, you know, there's relationship boundaries, there's information boundaries, and it's a lot more than just thinking, you know, I have to do the right thing. Okay. So yeah, there'll be a lot of detail placed on the hours that are focused on legal and ethical issues.
So in this environment, is it a kind of one-on-one thing, or is it a one with several experience? Does the CDCA work with just one person at a time? Or can it be a group? Usually
speaking, the CDCA would be one-on-one, but a CDCA can, they can carry on like group therapy, which would be, you know, it's going to be monitored by, you know, someone who is a higher up, and so it's not like you're just sticking them in a room and, you know, here, you figure it out. There's a lot of training that goes with it. Again, you've got your treatment plan, you've got your reporting process, so there's a lot of, you know, I's to dot and T's to cross.
Good. I'd like to remind you that you're watching The Voice of Rio Grande. Today's subject is our new program in Chemical Dependency Counselor Assistant, and I'm Craig Klein, the Dean of Community College Programming at Rio Grande Community College, and I'm joined by Rio Grande's Dean of Students and classroom instructor for this program, Mrs. Dena Warren. So let's go on to what we hope will happen as a result of this training, otherwise known as outcomes. So let's take a look at our first slide. Okay, they have all these outcomes that we're going to see, and I think there are 6 of them altogether. So the first one is understand substances and their effects. So, not to put too fine a point on it, how many substances are there?
Just when you think you know them all, they have another and then another. There's a lot of substances out there that can be abused, both legal, illegal, illicit, over-the-counter. You know, it's just the number of substances that we have in our society today are unreal when you look at how time has changed. So just understanding substances in general, knowing that when you put drugs into your body, it changes the way your body reacts, and then understanding the effects of them is important. Is an important starting point actually with this class.
I would think it would be, and like you said, some can be obtained just by walking in to any given commercial operation and others.
Or, you know, visiting a medicine cabinet while you're at someone's house.
And there, ooh,
Yeah.
really? Okay. So let's move on to the second outcome. Here, we want to, this is fairly wordy, identify stages of change, engagement strategies, and the 3 primary models of treatment. Let's take these one at a time.
Okay.
Stage of change. This is as a person progresses through their
Right.
addiction and or recovery.
Just understanding the difference in use and abuse and misuse, because they aren't all the same. Just understanding that drug addiction is chronic, and it can be, of course, you know, deadly in the end. Understanding engagement strategies, again, when people use, why people use, coping skills, the lack of coping skills. We don't even have enough time on the show to talk about all of them, but
there are quite a few.
There are
Clearly
quite
a
a
lot.
few, and spending, you know, spending a lot of time with students who are in this course, just again to focus on the importance of.
Okay, so we talk about 3 primary models of treatment. Are you able to briefly go through those, or just a general
Just
description?
in general, when you talk about models of treatment, whether you're talking about individual, whether you're talking about group, whether you're looking at codependency issues, the treatment model will be different for each person. You have primary, you have secondary, you have tertiary. So again, there's different opinions on what should be used, when it should be used, and so we're not going to we're not going to tell people what they should or shouldn't use at an agency if they're hired.
Okay.
We're just going to give them the basics, and then they will have to learn from, you know, someone who's been in the field a little bit longer too.
But all of these things would be covered in the CDCA.
Absolutely,
course.
yep,
Very
yep.
good. Next slide, please. Our next outcome, here we go with ethics again. Adhere to ethical parameters of addiction counseling. Okay, this sounds very similar to something on our former list. Understand the legal issues related to confidentiality laws.
Right.
So how can you maintain confidentiality if you're a mandated reporter?
Well, because there are only certain things that you're mandated for. When you're working with someone who is at your agency, there are confidentiality that you sign, that they sign. If you need to release information to a court because it's court ordered, those are also going to be releases that have to be signed. You are HIPAA regulated, and so the information is just as if, you know, it were medical information at a hospital. And so those are certain criteria, and the person sitting in that CDCA seat will need to understand what they can or cannot disclose and who they can and cannot disclose to.
Okay, thank you for that. Our next outcome slide. This one is to understand screening and assessment, then how we gather information for a diagnosis. And so this sounds like DSM.
Right.
To me, perhaps we should explain what that is.
I mean, it goes back to the information we spoke of earlier. It's that initial information that screener is going to take. It's you know, age of onset. It's drug of use. It's, you know, last use. It's history of use. It's collecting all of the information that person can give. And then that information is passed on to a clinician to make that diagnosis.
Okay. Is it typical that a CDCA person would remain with the clinician or the actual counselor throughout a treatment plan, or does it?
They would stay as like a point of reference.
Okay.
Yes, yeah, because you're still that initial person doing that initial intake.
Okay.
And every agency is different, but it would be typical because you can always revert to that person's notes and the explanations, you know, given on that initial intake.
Very good, thank you. So our next outcome slide, and I think probably our last outcome slide. Well, this one would be case management. And let's take here, components of case management. Understand how it's key to substance abuse treatment. And here we go again with identifying legal issues.
Yeah.
Client treatment, all these sorts of things. So this is how to process information.
Right.
And in the correct way to process it.
Correct.
And where to store it and how.
Right.
And that sort of thing.
Right.
Okay, seems reasonable. Okay. Next up we have a series, we have one more here, general principles of groups. And this is our final outcome. So this is, I'm guessing, group group psychology?
Group counseling,
counseling.
you know, group therapy.
Techniques of one or two with several?
Right, because
Okay.
you know, when you're one-on-one, there are a lot of other things that are probably disclosed, but when you're in a group setting, it's about
Yes.
respect. It's about, you know, being able to control the group because, you know, certain situations can get out of hand. It's about just kind of being able to monitor and mediate, but still offer a service and deliver a service to, you know, aid in their treatment process.
Okay, thank you. Let's take a look now. We have a series of slides. Ohio and the region where we're located in Southeast Ohio is known at a certain organizational level in the state as the Athens region.
Right.
Okay, so the Athens region clearly runs from, let's say, Athens to where? Down to the Kentucky border?
Down, yeah, West Virginia. It runs down through West Virginia and then over towards.
Okay.
I don't know if it hits Kentucky. I don't know if we have
Okay.
that map, but
Let's go back to
it's
that
our
slide
area.
for a second.
It's our area.
Let's go back to that slide we just saw. Okay, so we're seeing here what?
Well, we're seeing an increase in fentanyl, in meth, in illicit NEURONTIN, and the availability of that in our area.
Okay, tell me what NEURONTIN is.
NEURONTIN is, how do I put it in layman's term?
It's a substance that can be abused.
Yeah, and it's used for treatment.
It's a substance used in the treating of, okay, that's
Yeah,
good. That's good. We're good.
I just lost it. I'm sorry.
It's okay. That's okay.
It's been a long day.
I understand. I do. Let's take a look at the next slide. Okay. We have.
So we're seeing a decrease in ecstasy and heroin, which is a good thing, but we're replacing heroin with fentanyl, which I think is the next slide. We see that substitution.
There's fentanyl,
yes.
and
yeah.
Simply because it would seem a timely and topical reference. What was it that that took the life of the performer Prince? Was it
Fentanyl.
fentanyl?
Yes.
What is fentanyl?
Fentanyl is a, well, I'm not doing well here at the end. It's an analgesic, I believe.
Okay, and the effect on a person when they take it?
Sedative.
Okay. Okay.
And so you take too much of it, you go to sleep, you don't wake up.
That's right. Okay, so that's on the rise, but something like heroin is on the decline.
Right. Well, in our area.
In our area,
yeah,
but not necessarily other areas, even
which
in
means
Ohio.
that it's probably just easier and cheaper to get a hold of fentanyl at this point
Okay.
than heroin.
Okay. Let's take a look at our next slide. Okay. Some users of VIVITROL, and perhaps I shouldn't ask you what VIVITROL is.
It's not going well here at the end.
Okay. Okay, and they have switched from what, heroin to cocaine
Yeah.
and meth,
And meth.
methamphetamine?
Methamphetamines, yeah.
Okay.
And it looks like meth is becoming the most available drug in our region.
Okay. You think that has anything to do with the rural nature of our area?
I think so, and also because the substances you use to make meth, I mean, you know, we can probably go open a cabinet over there behind Mike and find some of the stuff we need. It's just very simple to make and use, and it's often made and used for personal use, so I'm not worried about, you know, making money off of it or selling it to someone. With meth, it's just about, you know, supply and demand for myself rather than, you know, someone who would sell heroin for money or someone who's, you know, trafficking, say, fentanyl on the street. Meth is just very accessible. We saw a real rise in it in the mid-2000s, and then we saw some decline, and now we're seeing it again.
Is it true that part of what is needed to create or make methamphetamine you might find on a farm?
Oh yes,
Yeah.
absolutely.
Ingredients that might be used, say, for fertilizing?
Right. That is one of the active ingredients. You can go out into your garage and get 2 or 3 cans and a pop bottle and some black tubing. And I don't want this to be a how-to session, but no, it is.
No.
It is very simple.
It's simple to
compose and make.
Okay, very good. Thanks. Let's take another look at the slide here. Oh, here's NEURONTIN again.
So, and we're watching an increase in the prescription of NEURONTIN.
Okay, and so is this sort of like watching the increase in opioid prescription, or that's not really a... a fully valid comparison?
Yeah, it's not, I mean, it's kind of apples and oranges, but it is by prescription, which is often, you know, what we see when you look at opioid addiction and how it started 15, 20 years ago. It was, you know, pain medication that someone took and then abused.
It's slowly gone
yeah,
to.
right.
Okay. Our next slide, please. And we're back where we began. We have a course syllabus that could be yours if you would only sign up for the course. Can this course be taken anywhere but on our campus here right now at this point?
No, not at this point, but you know, that's something that our campus computing and networking, I think, is working at and looking into, and hopefully the success of the course will, you know, increase the opportunities at our off-campus sites, because I think that would be a wonderful opportunity for other students.
Okay. And this is a so-called, this program leads to the awarding of a certificate.
Right.
Which in academic speak very quickly is stackable.
Right.
Because there's a part 2 and
Correct.
on and on and on. So this could be the beginning of a career pathway for a student.
Be.
And with that, we're going to have to leave it there.
Okay.
Okay.
Good, because my mouth is dry.
I'd like to thank you for joining us. This is Mrs. Dena Warren, and she's the Dean of Students at Rio Grande Community College, and she's also the instructor for our new Chemical Dependency Counselor Assistant program. For the Voice of Rio Grande, I'm Craig Klein, Dean of Rio Grande Community College Programming. Thank you for joining us.